Welcome to this session, Sunday afternoon session for Epidemiology and Public Health Part 2, Risk Factors and Outcomes. My name is Caleb Mishu. I'm here at the University of Nebraska Medical Center, introducing our first speaker, Andre Lucchini from the University of British Columbia. We'll have Q&A right afterward.
Thank you for the opportunity to present our study. There are no financial relationships to disclose for this presentation. Rheumatoid arthritis is the most prevalent type of inflammatory arthritis, and it affects especially women in the prime working years. There were advances in treatment and work cessation. However, work disability remains a huge problem for patients with RA. For example, more than a third of patients within 10 years of onset of the disease lost their jobs in 2008. Besides, indirect costs are an important proportion of total costs of RA. Despite this burden, few services exist addressing employment issues for patients with arthritis. This was identified by patients as an important unmet need in prior studies. It's to address this need that our team developed the Making It Work program. Our objective was to evaluate the effectiveness of the program over 2 years at improving presenteeism, or decreased productivity at work, and preventing work cessation in workers with inflammatory arthritis. Our study was designed as a 2-year non-blinded randomized controlled trial. Participants were randomized to being enrolled in the program or receiving usual care plus printed material on employment and arthritis. We used block randomization with variable size and stratification by disease and study center. After the 5-year follow-up ended, the program was offered to usual care group as well. Participants were recruited from 3 Canadian provinces through rheumatologist practices, consumer organizations, arthritis programs, and a health benefit plan. They were eligible if they had a diagnosis of inflammatory arthritis, were employed at baseline, aged between 18 and 59, had no intention to retire in the next 5 years, and were concerned about their ability to work. The Making It Work is a self-management program designed to help people with arthritis deal with employment issues associated with the disease. It's delivered online and consists of 5 modules that people complete on their own time, covering topics such as dealing with fatigue, stress, and disclosure of disease at work, teaching skills such as effective communication, and requesting job accommodation, as well as supporting behavior change through problem solving and goal-setting strategies. For each module, people participate in online group meetings facilitated by a vocational counselor, where they discuss and share experiences. This is followed by individual consultations with a counselor and an occupational therapist for ergonomic assessment. We collected socio-demographic, disease and work-related data at baseline and work outcomes every 6 months using online questionnaires. These were the variables we measured at baseline. The constructs were carefully selected from the literature and measured by reliable self-report instruments. The RCT outcomes were presenteeism, measured by the Rheumatoid Arthritis Work Stability Scale, analyzed at 2 years. Time to work cessation of at least 6 months duration was a primary outcome, which will be analyzed at 5 years, and interim analysis at 2 years. And time to work cessation of at least 2 months duration as a secondary outcome, analyzed at 2 years. Please note that the different durations of work cessation were approached as separate events for the survival analysis. Work Stability Scale has 23 items and measures the mismatch between individual functional ability and work demands. It was designed to identify workers at high risk of future work disability, warranting vocational counseling. The scale has evidence of good psychometric properties, scores ranging from 0 to 23, and cutoff points at 10 and 17. We performed an intention to treat longitudinal analysis over 2 years. For which we used linear mixed effect regression models with sandwich errors, which are robust to non-normal data. And for time to work cessation, we performed survival analysis. We checked the robustness of our results in sensitivity analysis using different methods for imputing missing values, transforming the primary outcome, and adjusting for baseline covariates. All analyses were performed in SAS. A total of 564 participants were recruited, with 85% completing 2-year follow-up. Baseline characteristics were similar between groups. Mean risk scores were significantly lower in the intervention group from 6 months onwards, with the greatest difference observed at 2 years, yielding a standardized effect size of 0.32. The clinical significance of those results becomes evident when we take into consideration the risk cutoffs for risk of work disability. The mean risk score in the intervention group decreased from medium to low risk, while the mean in the control group remained at medium risk. Occurred less often in intervention group for both outcomes. The difference between groups reached statistical significance for work cessation of at least 2 months duration. The adjusted hazard ratio shows that people who received the program were 35% less likely to stop working for 2 months or more. For work cessation of at least 6 months duration, 2 years was an interim analysis, and the difference was not statistically significant. Therefore, the trial will continue until the initially planned analysis at 5 years. In conclusion, the program was effective at improving presenteeism and preventing short-term work cessation. The effectiveness at preventing long-term disability will be assessed at 5 years, according to the initial plan. The program fills one of the most important and costly unmet needs for people with inflammatory arthritis. We acknowledge all participants, co-authors, staff, rheumatologists, consumer organizations for supporting the recruitment for the study. This research was funded by the Canadian Institute of Health Research. Thank you.
Okay, this abstract is now available for comments and questions. And I'll lead things off. Just curious about any pointers or the feasibility for other folks to be doing it at their sites and locations.
Sorry, it's a question, I'm sorry.
Sure.
You mean about the feasibility of the program?
Yes, feasibility of the program for implementing the thing at different locations.
Yes, as it is 100% online, even the group meetings with the vocational counselors, the feasibility was thought at the design phase. So it's quite simple. The questionnaires itself are for the RCT, but the program itself, they are 5 modules online, and the person can take the courses the time they are able. So the shift they work, it's not a problem for them. And the feasibility, our group has made a study of feasibility and how the participants approach to the program itself. But my intention is not this one right now, but it was quite well received with high rates of retention through 2 years.
Wonderful. And then any issues with overall access, considering it's a program that's online?
Well, for the program and for the RCT, we provided the participants with all the infrastructure. And of course, if we consider different countries where it could be implemented, there are different challenges. But I think now the internet is much more democratic than it was some years before. So I think it's the feasibility question is a great point of the program.
Very fair. I don't see any other questions online, so I'm going to move on to our next speaker. And apologies if somebody put something in the comments, but please feel free to do so, and our speakers will be able to address some of the comments later on too. The next talk is from Haral